Assalamu alaikum. Let me welcome you on behalf of Ahsan Academy for a small session on anatomical terminologies. I will discuss three objectives during this small session. So, orientation of the general anatomy, just various terminologies will be discussed, and utility of the terminologies. These two words, poor and rich, bear some meaning. Suppose let me show one photograph. Observing this, the features of this boy, we can say that this boy is a poor guy. But how can we confirm that the meaning is correct? You see another photograph having the similar dress, but definitely this lady is not poor. So mere listening the features or observing the feature, the meaning we may mislead. So anatomical terminologies are having the two forms. This naming word, only naming word may mislead the meaning. So always the naming word should be backed by some describing words. And anatomical terminologies, for understanding, we should know the meaning of a naming word. So in this way, continue the session. These are various positions in the body. Human can stand on hands or can lie down. But which position is correct in anatomical language? You see, if we consider one organ, like let me consider the liver. So the liver in this person is in this position, means it has the surface that directs upwards, the end that directs to the left, that surface that directs to the right. So if we consider liver of this person, everything is turned out. Previously, we said this surface or this end is facing up, but now it is facing down. If you consider the same lever, then it is directed, that surface same which was in upper part is now on the left side. So in anatomical, for explaining the anatomical terminologies, we accept one position as the standard one, and this is the standard position of the body in describing the anatomical terminology. So this position is termed as position. So that we can see this human being with a particular position with some features. What are those features? The body is in erect position, the foot are parallel on the floor, means on the ground, eyes looking forward, arms are at the side of the body, the palm directed forwards, and the fingers are pointing downwards. So these features, when combined together, this is the anatomical position. So in this position, every organs in the body are in a particular position. So the position of that organ is the anatomical position of that organ. Like you see, this is the liver. So a liver is in this position for that human being in a particular position. So this is the anatomical position of liver. So the surface here facing up is the standard position of that surface. The standard name of that surface means this is the upper surface. So in anatomical position of the body, we use some reference position to describe the human anatomy. They describe the human anatomy organs. So we take help of some plane to better explain the positions of particular organ or position of a particular area of the organ or a particular point. So those are known as planes. That's an imaginary plane that divides the body into different component parts. So we use the reference planes for the explaining purpose, the explaining the anatomical structures. So these are the three types of planes we use. This is the sagittal plane, coronal plane, and transverse plane. So sagittal plane actually divides the body into right and left parts. So which one, if one is in the midline, it divides the body into right and left half on the surface. So this midline plane is known as the mid-sagittal plane, or in a simple word we used to say the median plane, and the plane parallel to that plane and known as parasagittal or simple sagittal plane. So sagittal planes are series of planes that separates the body into right and left part, and this midline plane is known as median plane. The plane perpendicular to that divides the body into anterior part, means front part, and the back part is known as coronal plane. So this is also series of planes, and transverse plane is vertical to both of these coronal and sagittal plane, and it divides the body into upper part and the lower part. So these planes are used for particular some purpose. We know that MRI, CT scan, X-rays, these are the investigations we use to identify the problems of the human being, to identify or diagnose the disease. You see, this explains how this is helping in understanding the anatomy. You see, in the CT scan or MRI, this is the scanning. So this is actually explaining the anatomy in normal coronal plane. So if we see this one, this is the colored expression of the structures, anatomical structures in the coronal plane, a particular position, particular points. You see, this is the median section. It is this uh, investigations, this MRI scan is showing the structures in the median plane, anatomical structures in the median plane. You see, this is the CT scan showing the anatomical structures on the transverse plane. So anatomical knowledge of this plane will help you to understand these investigations or scanning reports. You see, this is the coronal section of the human chest, and we can see this is the median section of the human head, and this is showing the transverse section through the belly. So all anatomy in the sections are reflected in investigation. Suppose we are interested to know what are the anatomical structures present at the level of the eye. So we can take an MRI or CT scan to examine the anatomical structures. So anatomical planes or understanding the anatomical structures in a particular plane will help us. This figure is the coronal section passing through the thorax. So anatomical knowledge of this section will help you to understand the X-ray, which is actually reflecting the coronal view of our body. You see, this is showing the transverse section of the various level of belly, and you can compare it with the investigation MRI that is reflecting the anatomy of that section. You see, this is the MRI of the belly. You can have the conception of the anatomical structure at that level, which is shown in the figure. We use these planes and reflecting this plane on the surface to localize the disease, to understand the position of the disease in the organ. So suppose this is in the stomach, we can say this because of the position of the tumor, this is situated in the stomach. So the body is actually, the doctors are using this plane and drawing some lines on the surface and localize the disease, that is the most likely position of the disease. we explain the terminologies under two big heading. One is the positional and another is directional terminologies. Let's terminologies now. Actually, the directional terminologies uh, helps us to understand the position of a particular point. It is superior. Superior means it is towards the head or towards the top. You see here the arrowhead is showing the position of the diaphragm and the lung above it. So this is lung is superior to the diaphragm, means it is on the superior surface of the diaphragm. The contrast terminology is inferior, close to the tail. Cauda means tail, so it is close to the tail, away from the head, towards the bottom, is known as inferior. So in the same case, you see the liver is below the diaphragm, means it is on the inferior surface of the diaphragm. So lung is superior to the diaphragm, liver is inferior to the diaphragm. The terminology is showing the section. So section back and fronts are visible. So the back or front, these are two contrast terminology. The front is known as anterior. So towards the front, close to the front, on the front, the anterior. Ventral is the alternate terminology. So the navel is situated on the anterior side of the body. The contrast terminology is posterior. This is another term is dorsal. So towards the back, see the kidney is on the back wall, means posterior to the intestine. Intestine is a bit forward in position, so kidney is relatively back in position. You can see in the section the anterior part, the intestinal coils are visible and kidney is on the back. This is the median point. The line indicates the plane position of the median plane. So anything this we can get in this line or close to this line. So towards the midline of the body is medial in position. This terminology usually we use in comparison to the other one. The heart is in the median plane. It is sectioned by the median line. Contrast terminology is lateral, so away from the midline of the body, and we can use the comparatively the nose is in the midline but the ear is away from the midline, so ears are lateral to the nose. And in the same way we can say eyes are medial to the ears, it is close to the median plane. So as a comparative terminology. Internal or reverse, another terminology synonym is deep, away from the surface of the body, means the skin is on the surface, so we will go deeper, then it is internal. You see the bone of the head is cranium, so inside cranium the brain is situated, so it is internal to the cranium. External means on the surface. Another terminology is superficial. So deep or superficial are the contrast terminologies towards the surface of the body. So we can this skin is external to the muscles. Muscles are internal to the skin. So in this way we can terminologies. A bit complicated terminologies are proximal and distal. The proximal towards the root. You see the limbs are attached to the trunk by the root. So close to the junction of the root arm is proximal. So elbow towards the attachment, then the wrist. So elbow is proximal to the wrist. So it's also you can use it in comparative way. The knee is proximal to the foot. You see distal is the contrast terminology, away from the trunk or head or attachment, beginning is used as the distal. hand is distal to the elbow. Elbow joint is proximal to the hand. In this way, we can say, suppose a complicated tube is in the abdomen, in the belly. If we want to explain it, suppose this one is the attachment to the lip, and the arrow is indicating lower part is the terminal end is the arrowhead. So if we take 2 points, one is larger one, the yellow dot is very close to the root or attachment or origin, and the smaller one is a bit away from that point. So let us follow it from both the points from the attachment or root or beginning. Then you will find that the smaller one has come first, then the larger one. So the smaller one is proximal. It should be understood in this way. The larger one is closer, but it is not proximal. It is distal because we are following the root from the root. So this is the proximal one, and that one is the distal structure. In this way, we can explain the various tumors like from a particular point, that attachment of the vermiform appendix, it is 10 centimeter distal from the base of the appendix in the large intestine. We can, in same way, we can say that it is situated in the small intestine from 10 centimeter from the distal end of the stomach. So the doctor will find this area from in the 6-meter long tube easily. So far we have got superior or cephalic, means nearer to the head, anterior or ventral, nearer to the front, medial means nearer to the median plane, means midline, superficial means nearer to the skin, external means nearer to the outer surface, proximal means nearer to the root of that structure. Every terminology has the contrast terminology, like superior has inferior, cephalic has a caudal, anterior has posterior, ventral dorsal, medial is lateral, superficial deep, external internal, proximal is distal. You see, we can combine these terminologies in this form. Anterior inferior means it is formed close to the front and close to the caudal end, distal end. In the bone, you see, just I am using the descriptive terminologies as an example. In relations to the bones, we may get some naming word with some explanations, like describing words. Condyle means rounded articular area. There's a large rounded articular area, means lower end of the femur is condylar. Epicondyle, eminence just close to the condyle, on the surface of the condyle. This is crest, ridge of the bone. Foramen means passes through the bone. A fossa means hollow or depressions on the surface, notch, indentation at the edge of the bone. It's a sharp margins. Process is a projecting spine-like part. Spine that has a tip, thorn-like tip. Trochanter is large, blunt elevations. Tubercle, small, raised eminence. Tuberosity, this is larger, rounded elevation. So in this way, every terminologies, that is naming terminology, we must know the describing words so that we understand and we can mention the name correctly in this way. In several times this will come, and in time I will describe, inshallah, the various names of the movement with their describing word. Thank you for staying with